My name is Anne Corson. I'm a medical physician, and I've been a member of ILAD since 2003. I studied in 2003 under Dr. Brascano, and that's when the physician's training program sort of began. And I met Stacy Groden on both the times that I was in his office, and she was just getting Turn the Corner Foundation started, and that's when the whole idea for the physician training program was birthed, so to speak. And then in 2005, I went up to visit with Dr. Jones. And then I think I started to have doctors in to train with me as early as 2005. But in 2009, Turn the Corner Foundation honored me for my contribution to the physician training program. I think by that time I had had over 10 doctors in the office. Now I think that number's up to over 15. I'm not sure if we can ask Gail to count. And I know I've got 2 doctors coming in this fall. Well, I initially got into treating Lyme because of my own child's illness. I have one son, and he started to become chronically ill between the ages of 10 and 14. And really I started to search for why he was ill. And I had a friend of mine say, well, he's got Lyme disease. I said, well, how can he have Lyme disease? I've done the ELISA 3 times. I keep thinking about it, but it's negative. Because that's what I had been taught by the American Academy of Family Practice. Well, I was invited to, I was given a flyer to Joe Brascano's lecture that he gave at the Unionville High School in May of 2003, and I came out of that lecture just like more intellectually stimulated than I'd been by any lecture I'd heard in years, and it was like, oh my God. So I went right to the website, I downloaded his treatment guidelines and read them. And then I downloaded and filled out one copy of the symptom complex, the symptom questionnaire in the Lyme Disease Association of Southeastern Pennsylvania's Lyme Basics. The color of the book has changed over the years now. It's got a green cover. So I made a copy for myself and a copy for my son. I checked off all the symptoms he had. Then I picked him up at school. I had him check it off, and he had more symptoms than I thought he had. And so I started treating him. And within 6 days, he said, Mother, when he woke up, I can't open my hands. He'd never had joint pain. So I said, you're having a Herxheimer. You've got Lyme disease. So I finally had an answer. Well, he turned out to be a lot more complicated than just Lyme disease. So really, my son's illness and the complications that he's had throughout the course of his treatment has really led me to understand how to treat these really incredibly complicated and sick patients. So that's how I got into this chronic illness deal. The challenge that I have really faced has been figuring out how to help people and how to make them better and how to improve the quality of their lives. And that journey has taken me to lots of new places and lots of new frontiers in medicine that I would never have thought that I would go to before as an allopathically trained physician. I've had to learn a whole lot about other systems of thinking about chronic illness and other tools to use to treat chronic illness. And it's been really very interesting. Many of my patients have had wonderful success. I think for me, the most rewarding is watching the children get better. As a family doctor, I treat everything from pregnant women to old people. I have some patients in their 80s and 90s. But what's most satisfying to me is watching the kids get better. Just to give you one illustrative case, I started seeing a child when he was about 8. He was 2 years behind in his educational development. He was on seizure medicine, who has low growth, failure to thrive kind of kid. And now he's going into 8th grade. He's above level in both reading and math. He hasn't had a seizure in years, and he's been off all seizure meds for a long time. And he's still a little bit short, but he's starting to grow. So those are the kinds of things that I see. A child will be able to get back to playing sports, or somebody who's been on unemployment or disability can't work can get back to work. Those are the fun things that I see, and it's a joy to watch people get better. Some of the challenges I think that we face in treating tick-borne diseases is recognize the diversity of the pathogens that are involved, the ubiquitousness of the presence of these different pathogens. It's not just one spirochete. Ticks are cesspools of disease, and they can give people all kinds of things. And then you've got the patient's underlying makeup. The vast majority of people that see me are of the quarter of the population that are genetically weak in fighting off a lot of these problems that happen from chronic infections, and they don't get rid of the toxins well from chronic infections and from things like indoor toxic mold, and they're the people that really get chronically ill. So that I think for me the most significant challenge is to get other healthcare practitioners to recognize the fact that it's not just a spirochetal infection, that you've got a protozoan here, and you've got other bacteria, and you've got opportunistic viruses, and you've got a genetic set point in this particular patient that you might not have in this patient that makes the first patient chronically ill and the second patient gets well easily with just a little bit of treatment. So they've got to recognize the diversity of the problem and then realize that there's not a cookie-cutter approach to treatment. What does the training program mean to me? Well, I have a real special place in my heart for the training program, seeing as I was the first one to ever study with a ILADS doctor with the intention of learning more about what he did. As I told you, that when I first went to sit and meet with Joseph Brascano, it was just wonderful. I had the best week. It was the week of early July 2003. And when I sat and asked him and say, how many other docs have come to study with you? He says, well, you're the first one. He says, but I got somebody coming in a couple of weeks from England. So David Owens was the second one, and he was from Wales. And I couldn't believe that. I couldn't believe that there wouldn't have been other people wanting to come learn. I was so surprised. But it just started to snowball. I went back and spent another week with Joe Brascano in September of that year, and I met Jackie Springer at that time. She was doing some research into the growth hormone and figuring out that, the problem in a lot of the real chronic Lyme patients really comes from the hypothalamus and is a whole falling down and disruption of the neuroimmune and neuroendocrine systems. And it's more complicated than just growth hormone, but that did help those patients while they were doing that subset of patients. So the training program means a lot to me, and I wouldn't be able to be here doing what I'm doing now if I hadn't had the opportunity to go study with Joe and later also with Ray Jones. I really feel it's important to give back and to try to educate and train other doctors who are just stumbling upon this very interesting but complicated world of tick-borne diseases. That all of a sudden, there's that aha moment like I had over 10 years ago now. And it's really gratifying to be able to teach them by having them see how I ask questions and start to understand symptom complexes that mean this and what symptom complex means that, and to recognize these things and to know what to look for and to know what different changes in the treatment course mean when you're taking care of patients. So that's very satisfying to me. Well, it's very important for us to continue to educate doctors, and I think that we're going about that well, developing the programs that ILADS is doing. What really inspires me? What inspires me is seeing my folks get better and knowing that I have the ability to educate both patients and other physicians about the truth of what's really going on, and showing them how to handle things in a compassionate way, and always sitting down and listening to what their patients have to say. And then, having the forbearance and the tolerance to slug through what you got to do to teach people how to get better and to try to explore the different aspects of what is creating their chronic illness. I guess that's what inspires me the most. Hopefully all of us are trying to teach as many of our colleagues as we can about it. But that's why, if more people are actual trainers in ILADS, I think we should have more people be trainer physicians in the program. The people that come to see me are really the ones that are interested in alternative medicine that aren't straight line allopathic doctors. So we each have our own sort of skill set that we use. The way I treat is a little bit different than the way several of the other ILADS doctors will treat. So the people that come and preceptor with us are the ones that are interested in our mode of treatment and our style of treatment. But I think that we have to have as many preceptors as possible in the ILADS program, and then develop maybe a web-based video lecture series, that goes through everything, or combine parts of lectures of the basics, that the nuts and bolts basics that, Richie and Joe have all been giving and other people have been giving in the ILADS, and just use those as web-based, teaching tools to reach more people that we can't reach on a one-to-one basis. Visit www.ilads.org, that's ILADS.org, and that will give you a great deal of information.